A very good day I bid to everyone. We are from Group D. We are going to present about Otitis Media with Effusion. The contents of our presentation consists of introduction, clinical presentation, investigations, and management. As a definition, otitis media with effusion is when there is presence of non-purulent fluid in the middle ear space. The effusion may be thick, glue-like or thin, serous in nature. It is commonly seen in young children 3 to 6 years old attending kindergarten or nursery. This is because their eustachian tube is more horizontal and straighter, making it easier for bacteria to enter. They get URTI often because lower and delayed immunity to recognize viruses. Etiology. Etiology of otitis media with effusion includes the first one, eustachian tube dysfunction, which can be seen in adenoid hypertrophy or adenitis, recurrent URTI, rhinitis, palatal defects, for example, cleft palate. The second one is allergy, and the third one is nasopharyngeal tumor.
Patients with otitis media with effusion are usually presented with reduced hearing, which leads them to increase in the television volume. They will also be presented with delayed speech, ear discomfort or otalgia, ear discharge, less responsive to cold, and also nasal symptoms. However, in young children, we can see that usually they will be presented with persistent ear tugging and pulling. In general examination, we can see cleft palate in children with unrepaired palatal defect, mouth breathing or hyponasal speech in patients with adenoid hypertrophy, usually in children, allergy shiner or salute, usually in allergy rhinitis children, sneezing or rhinorrhea in rhinitis patient. And for external ear, we can look for any deformities, any signs of infection at the pinna, postauricular, mastoid, and preauricular region. We can also check for scars, swelling, and erythematous overlying the skin at the mastoid region. And also, we can check if there is any illicit tenderness at the concha, tragus, and pinna, but not in this case for otitis media with effusion. We can also do tuning fork in older child or adult where we can conclude that they might experience conductive hearing loss, which is Rhine test negative.
For the investigations, we can do tympanogram and we can get type B or type C curve for otitis media with ear effusion. Type B, which is a flat curve, shows there's fluid in the tympano-ossicular system, and type C shows that the middle ear pressure falls below normal in eustachian tube dysfunction. For the management, for patients with underlying allergic rhinitis, allergen identification and avoidance should be done. Medical management such as antihistamines, intranasal steroid spray, and nasal decongestants should be given. For surgical management, myringotomy and grommet insertion should be indicated when there is persistent otitis media with effusion after 3 months of compliant medical treatment, allergy avoidance. We can also give speech therapy in children with delayed speech, provide vaccination for influenza or pneumococcal, and we can also perform adenoidectomy or cleft palate repair in patients with these etiologies for otitis media with effusion, and we can provide hearing aids in children with chronic otitis media with effusion with poor speech development.